this morning that there's closed captioning available if you click show subtitles at the bottom of your Zoom screen. My name is Emily Broadleave, and I'm the faculty director of the Harvard Law School Food Law and Policy Clinic, which is an action learning program that serves partner organizations and communities by providing guidance on cutting edge food system issues while educating and engaging law students in the practice of food law and policy. We specifically focus on increasing access to healthy foods, nurturing sustainable and equitable food production systems, reducing waste of healthy and wholesome food, and supporting community-led food system change. This webinar is part of a series that's under our ARCS project, the approaches to reducing the consumption of sugar. And this project is supported by the Arnold Ventures Fund. Through this project, the Food Law and Policy Clinic has been offering pro bono technical assistance to community organizations, food policy councils, and state and local governments since 2018. And we offer this support to organizations that apply directly to us for technical assistance in implementing innovative sugar reduction policies. I'd like to also welcome the many site partners who are joining us this morning for this webinar. We're so glad to have you here. In addition to the work directly with sites, we also are doing some work to pull our sites together and bring this broader messaging through things like this webinar, which originally was going to be a conference, but due to the COVID pandemic, we're going to be doing a webinar series instead. And we'll also be publishing next year a toolkit that's really about opportunities at the state and local level in terms of sugar reduction policies. In the past year, COVID-19 has really increased the visibility of public health risks and the relationship between hunger, food security, and health. We're looking forward to further breaking down these silos in today's webinar and also the future webinars in this series, and promoting holistic solutions to food insecurity and malnutrition. Before I turn it over to our moderator, I want to give a huge thank you to all of the staff at the Food Law and Policy Clinic and the Center for Health Law and Policy Innovation who have planned today's webinar and who have been involved in this project. In particular, Melissa Shapiro and Joseph Beckman, and also Kristen Sukes, Katie Garfield, and Sarah Downer. And a huge, huge thank you to our amazing panelists for today. With that, I'd like to introduce our moderator, Christina Roberto, who has also been consulting with us as part of the ARCS project for the past 2 years. Christina is an associate professor of medical ethics and health policy at the University of Pennsylvania Perelman School of Medicine. She's trained as a psychologist and epidemiologist. Christina directs the Psychology of Eating and Consumer Health, or PEACH Lab, where she researches environmental forces that promote unhealthy eating habits. And then to do her work, she draws upon the fields of psychology, marketing, behavioral economics, and population health to answer questions that can provide policymakers and institutions with science-based guidance. She's an amazing researcher, scholar, strategic thinker, and partner, and I am delighted to turn this panel over to her now. Thank you so much.
Great. Thank you for that introduction, Emily. And I am also really thrilled to be here today. We have just a fabulous group of speakers. So I just want to go over one housekeeping point, and then I'm going to go ahead and introduce the speakers. Throughout the session today, what we're going to do is have folks enter questions in the Q&A. So please don't put them in the chat, put the questions in the Q&A. And each speaker will talk, but we'll reserve the actual question period till the end. So after everyone talks, then we'll segue into the question and answer. So please, throw up your questions as they're chatting, but we'll do that all at the end. So I'm now going to introduce our speakers. Our first speaker is Sarah Bleich. She's a professor of public health policy at the Harvard Chan School of Public Health in the Department of Health Policy and Management. And she's also the Carol K. Forsheimer Professor at the Radcliffe Institute for Advanced Study. And Sarah's research provides evidence to support policies to prevent obesity and diet-related diseases, particularly among high-risk populations. She's received numerous awards. She's well known for being an expert public health communicator, and she's served as a White House Fellow, where she worked as a senior policy advisor to the U.S. Department of Agriculture and the First Lady Let's Move initiative. So it's a really interesting perspective, both on the policy side and the academic side. Her undergraduate degree is in psychology, and she's got a PhD in health policy from Harvard. So we're just really delighted to have Sarah here. Our second speaker will be Erica Kenny. She's an assistant professor of public health nutrition at Harvard School of Public Health, where she also directs the MPH program in nutrition and the PhD program in public health nutrition. She's trained as a social epidemiologist and also in planned behavior change. And her research focuses on identifying successful, efficient, and cost-effective strategies to modify children's environments to make the healthiest choice the easiest choice, and to help children form healthy habits for life. Erica earned her doctorate in social behavioral sciences at Harvard and an MPH in behavioral sciences at Yale, as well as an undergraduate degree in education studies. So a really interesting mix. And both Sarah and Erica have just published a ton of really important high impact papers, and they're constantly being covered in major news outlets for their work. And then finally, I'm delighted to introduce our third speaker, Julie Ralston Aoki, who's the Director of Healthy Eating and Active Living Programs at the Public Health Law Center at the Mitchell-Hamlin School of Law. She has over 10 years of experience working in the areas of consumer protection law and public policy development at the state level. And in the public health law arena, she has experience in providing legal technical assistance to local governments and public health advocacy groups on issues ranging from tobacco control to legal strategies and policies designed to promote healthy eating and active living. And she has a particularly strong focus on marketing practices. Julie is also an adjunct professor and currently teaches public health law at Mitchell-Hamlin. Just a few more notes about Julie. She served as an assistant attorney general with the Minnesota Attorney General's office for 9 years, and she's been named as a rising star lawyer by Minnesota Law and Politics. So we're thrilled to have you all here. I'm going to turn it over to Sarah to start our first, kick off our first speaker. Thank you, Sarah.
Thank you, Christina. And I should preface this by saying everything I know about beverage taxes, Christina knows more about beverage taxes. So if you ask any hard questions, I'll just send those over to Christina to answer. But I've been asked to talk about what do we know about the evidence and what are some of the key implementation considerations that we should have in mind. And so just to sort of level set everyone who's on the call, there are currently 7 localities across the United States that have beverage taxes, plus the Navajo Nation. And those range in size from 1 to 2 cents per ounce. Most just cover sugary beverages, but Philadelphia covers artificially sweetened beverages. And Cook County, which also covered artificially sweetened beverages, was a high profile repeal where the tax was in place for 4 months and then it was repealed. So the United States is not unique for having beverage taxes. More than 40 countries around the world have also passed beverage taxes that are in various phases. So what this is showing you is the past 10 years where countries that have implemented taxes are in green, countries that have failed or cities that have failed are in orange, and then you can see crossouts are where taxes have been repealed. The take-home message here is that there's been a lot of energy and activity that's been put towards beverage taxes in all sorts of places, in large part because the potential impact on sugary beverage consumption and the potential for raising revenue. So why do we care about beverage taxes from a public health perspective? Well, we know from mountains of epi evidence that sugary beverages are a leading source of added sugar in our diet. And if you drink sugary beverages, it's a major contributor to obesity and the risk of type 2 diabetes, heart disease, and many other conditions. And this evidence is quite strong. And if you look at sort of trends over time in the percent of adults and children who are drinking sugary beverages on a typical day, there are 2 take-home messages. Number one, that trends are declining. Over more than a decade, consumption of sugary beverages among adults and kids has gone down. And you can see those trends if you just run your eye across the slide. But take-home point number 2 is that consumption remains unacceptably high, particularly for Black and brown populations. And this is where beverage taxes have the potential to help close that gap. And you'll hear more about that potential for equity from Julie. So what do we know? So taking a step back for a second, there have been many studies published around beverage taxes in the past couple of years based on the 7 localities that have taxes in place. And I'm just going to talk about evidence in the US. There is other evidence from around the world. But in terms of the first order question, all the beverage taxes in the US are excise taxes, meaning they're applied to distributors who pass them through to stores, who then pass them through to customers. So the first thing we have to understand is how much of the weight of the tax is felt by customers. And across the studies, that pass-through ranges from about 8% to an overcorrection of about 120%. But the take-home point for our purposes is that beverage taxes are increasing prices. And they do so somewhat differentially across the different settings. And so what this is showing you is the various studies that have been done, what that pass-through looks like in different settings. And you can see there's a fair amount of variation, but prices are increasing. There's also variation by the types of retailers. And so beverage taxes are happening in any retail setting where there's a taxed jurisdiction. And so you can see there's quite a bit of variation in how much the taxes are passed through based on the different types of setting. There's also differences by the size of the beverages. So these are volume-based taxes in the United States, meaning that as beverages get bigger in size, so too does the size of the tax. And so what we see is that not entirely, but largely that individual size servings tend to have a bit more pass through than larger family size servings, but you can see there's overlap in these ranges. So that's the answer to the question of prices. What about the question of sales? And this is a second order question. If prices are going up, what is happening to sales? And there we again see pretty consistent evidence that sales of taxed beverages are declining. It ranges from about a 10% decline to about a 39% decline. And here's the variation that we see by taxed jurisdiction. Now, critically, one of the things that we have to watch out for is, are people leaving a tax jurisdiction to buy their beverages right outside the city limits so they can avoid the tax? And that's called cross-border shopping or tax avoidance. Some of the studies here take that into account, some of the studies don't. In a study led by Christina that was in JAMA a couple of years ago, looking at large retailers in Philadelphia, she did take that into account. And even after taking into account that about 25% of sales are leaving the city, that still left a 38% drop in sales of taxed beverages in Philadelphia. To put a finer point on that, that's 83 million fewer cans of soda or sugary beverages sold within Philadelphia within the first year. And so really big public health impacts potentially from these beverage taxes. We're also seeing differences in sales by the size of the drink. So the sales are dropping more for large items, which makes sense because the customers are experiencing a larger size of the tax for those items because these are volume-based taxes. So then the third order question is, well, okay, what's happening to self-reported consumption? And this is where the evidence is a little more murky. And where we know we have some empirical data is Berkeley and Philadelphia. Berkeley was the first place in the United States to pass a tax. Philadelphia came after. So in Berkeley, there's some evidence that sugary beverages are associated with declines in consumption, and some evidence that there's no decline in consumption. In Philadelphia, there's one study that has shown no overall change in sugary beverages, but at the same time found a significant drop in soda. So the take-home point here is that when it comes to the question of self-reported consumption, the results are mixed. But a methods point to make is that this is just a much harder thing to measure than something like changes in prices and changes in sales. So the other big question is, well, if sales are going down, are people getting their sugar fix by substituting for something else? And so Laura Gibson recently led a paper and found no evidence of substitution to sweet snacks. This is in the Philadelphia context. No evidence of substitution to alcohol. She did find some evidence of substitution to concentrates, think like Kool-Aid in supermarkets, but for the most part, there's little to no substitution, which suggests that people are not getting their sugar elsewhere because sales of tax beverages are falling. Another major question that comes up from anti-tax advocates is, you're going to have a negative impact on the economy and you're going to push people out of work. And so in a couple recent papers, there appears in one led by Hannah Lom, and there appears to be no changes in unemployment claims. And this is looking at industries that manufacture and sell sugar sweetened beverages. In a recent paper where Lisa Powell was the senior author, there are no job losses up to 2.5 years after tax implementation. Both of those are in the Philadelphia context. And then broadly, when you look at modeling studies in the alcohol world and the tobacco world where taxes have been applied, we're not seeing negative impacts on unemployment. So one of the big questions is, well, if we use a microsimulation model, what are the implications of a national beverage tax? And if you would have asked me 9-10 months ago, is there a possibility of one of these in the US? I would have said no. But now in the context of COVID with these enormous resource gaps, who knows? And so in this study, which came out in the summertime, it's estimated that a national penny per ounce tax would increase revenue by about $80 billion and avert quite a number of cases of cardiovascular disease and diabetes. And critically, it would have larger impacts on health outcomes among young adults, among Black and brown populations. So there's an equity consideration here that's important. And I'm going to say just a few words about equity because Julie's going to focus on that more. There are reasons to think that beverage taxes might have larger impacts amongst higher risk populations. One is that we are seeing some overshifting, meaning that prices increase by more than the size of the tax. There's some evidence from Philadelphia that some of this is concentrated in low income neighborhoods. And so if that overshifting is happening there, it may reduce purchases more. We're not seeing evidence of substitution towards high sugar foods, and that there are more purchases of non-tax beverages, think things like water, amongst low education shoppers. And the other thing is that the revenue allocation, so all this money that's being raised by beverage taxes, which is about $135 million across the 7 jurisdictions each year, that may have a disproportionately positive impact on high-risk populations. And so every city has allocating the revenue differently, but many of these tax-funded activities are focused on health or addressing social determinants of health. In the case of Philadelphia, a big slice of that pie is going towards pre-K slots for children in the city. So what about trying to get more beverage taxes, which is what a lot of you are interested in? It's really important to remember that there are many ways to design a tax, and there's not one optimal way to do it. If you look at the left-hand side of the slide, it's giving you options in terms of the different types. So do you want a sales tax or an excise tax? Again, everything in the US right now is an excise tax. Do you want to include sugar sweetened and artificially sweetened drinks? And how big do you want it to be? Right now, the range in the US is 1 to 2 cents per ounce. Now, on the right-hand side, there are a lot of questions about the actual structure. Should it be a volume-based tax like we have in the US, an absolute tax, or a tiered tax like you have in the UK, where the top tier receives the higher tax, which has the highest amount of sugar, and that tax goes down as the amount of sugar in drinks decreases. What I would say from a get it to happen in the real world perspective is that if you want to have policy diffusion, you need to really reduce the complexity. And what that suggests is that working towards sort of simpler volume-based beverage options or beverage taxes may really facilitate uptake by state and local policymakers, but this is something that remains to be seen. And so in thinking through, how do you effectively implement taxes, there's been a lot of thoughts put into this in Berkeley, and there's a recent paper that's cited here by Jen Falby's group, and a lot of thought has been put into this in the Philadelphia context. But through that, there have been some key lessons learned. And so, for example, having very clear and timely communication with distributors and retailers in advance of the tax going into effect is important, and giving folks lead time to actually do all the changes that have to happen before implementation is critical for getting buy-in from retailers and from effectively implementing the tax. And generally, early and robust outreach can promote public support and reduce some of the friction that comes from this natural prickling about this is another tax that people have to deal with. And if you want to learn more about this, I really encourage you to read the paper that's cited here at the bottom. It's also important to think about on the ground unintended consequences. So for example, if you choose something like a tiered tax, there's a possibility that in order to get drinks to go from that higher sugar level and bring it down, it could mean that you're using artificial sweeteners, and that has potentially negative health implications. That is in fact what is happening in the UK, and the jury is out about what health impacts that'll have down the line. Substitution and cross-border shopping are real possibilities. Again, we're not seeing substitution to a large degree. We are seeing cross-border shopping. And so understanding the potential for that and trying to account for it is going to be important. So to try to wrap up, one of the core questions that's often asked is, well, are beverage taxes regressive or progressive? If you take a very narrow view, you could make the argument that, well, beverage taxes are regressive because if you're poor, you pay more than someone who has more money. From a public health standpoint and sort of thinking about all the evidence, I think it's fair to argue that beverage taxes are actually progressive. And I'll just try to quickly go through a couple of reasons why. One is that they reduce purchases more. They appear to reduce purchases more among people with lower incomes or lower educational attainment. People that have low incomes tend to have higher SSB consumption. And so there's a potential that it could have a bigger reduction on adverse conditions associated with consuming those drinks. If we look at microsimulation models like the one that I just showed you, it does appear to show larger benefits for people of lower incomes. And the money that's being generated is being funneled back into programs that are largely designed to benefit more vulnerable populations. So the key takeaways are that while every tax jurisdiction is very unique, the story of beverage taxes appears to be that they effectively increase prices, they effectively reduce the sales of tax beverages, and that as a result, they are probably having an impact on public health. I would say that COVID might present an important opportunity for a national beverage tax, but obviously the jury is out about that. And there are really two core areas where we need more information. We need to understand the impact of beverage taxes better amongst high-risk groups. There's much less evidence on that. And two, we need to understand the impact of tax revenue on health, equity, and community well-being. And I will stop there. Thank you.
Wonderful. Thank you so much, Sarah. That was terrific and so clear, and you covered so much really helpful information. So now we're going to switch over to Erica Kenny.
All right, good morning, folks. It's so great to be with you all, and thank you for having me today. And I think it's good morning for most people. Maybe it's midnight for some folks who are on the call. I'm going to talk about a slightly different angle from a policy and public health nutrition perspective, which is the promise of child nutrition policies to reduce inequities in nutrition and health, and particularly when we think about sugar. So why focus on children specifically? A lot of my work focuses on children, and I kind of joke that the reason is because it's the easy thing to do in some ways. So children are developing their food preferences and their eating patterns, and there's a large body of research that shows that it's actually a lot easier to kind of change some of those food preferences. In childhood, they're a lot more plastic than they might be in adulthood, which if you are a parent of a picky toddler, you might be thinking I'm crazy right now, but it really is true that like a picky toddler, it's easier to change their eating habits than it is for an adult who's very set in their ways. But what we also know is that our current population diet patterns are really not set up for young children to develop like lifelong healthy habits. There's a lot of sugar intake among young children. They develop a preference for sweet tastes early on when they're exposed to lots of sugary foods and beverages. And also that there are some pretty stark disparities in healthy food access that are already present starting very early on in the life course. So we're starting kids off on a developmental trajectory pretty early on to have them have a less healthy diet. So one of the best tools for sort of addressing some of these inequities in diet and improving population health are our US child nutrition programs, which are some really, really amazing policies that we have here in the United States. So broadly, the sort of big ones that I'm going to focus on today are WIC, which is a program that addresses pregnant and breastfeeding and postpartum mothers, as well as their children up to age 5 who are low income, so at or below 185% of the poverty level. The National School Lunch Program, which is a program that most people are somewhat familiar with, that operates in nearly all public schools in the country, as well as the School Breakfast Program. The Child and Adult Care Food Program, which is sort of like the National School Lunch Program, but focuses on child care centers instead. And then the Summer Food Service Program. And these are sort of our big food assistance programs that kind of wrap around to create a safety net, with also SNAP being in the background as well as sort of the broadest program to help with food insecurity. Just so people get a sense of the scale of these programs, National School Lunch Program really dwarfs all the others. Nearly 30 million children participate in the National School Lunch Program, and the vast majority of the children who do participate receive those meals at a free or reduced price, which means that their families have incomes that are either, if it's a free lunch at 100% of the poverty level or below, or if it's a reduced lunch, 185% of the poverty level or below. So they are largely utilized by kids who are coming from very low income families. Same with the School Breakfast Program, and then also similar for CACFP and WIC. So you'll see that the CACFP, which is the Child and Adult Care Food Program, the participation is much smaller than it is for National School Lunch Program. And part of that is problems with sort of getting it out to as many centers and family childcare homes as it could be, but also part of it is just a function of the fact that it's a smaller age group because this is focusing on young children. One of the really exciting things that's happened in public health, nutrition, and policy in the last 15 years or so is to see these incredible policy shifts for a lot of these federal food programs, which many people who I think are listening on this webinar have had a role in bringing about. And this has been through massive effort at a lot of different levels and a lot of hard work by a lot of advocates and people who are advocates for food insecurity and nutrition. And a lot of really incredible work has been done. And I'm going to just focus on some of the big ones today and what some of the data have shown about these sort of success stories about what we can do to improve the health and the diet of low-income kids in particular when we channel it through these federal food programs. So as just a quick primer, in 2009, the WIC program had a huge overhaul to its food package that promoted whole grains, and it lowered juice, it lowered saturated fat content of foods, it increased fruits and vegetables. So it really improved the overall dietary quality of what was you could purchase with your WIC benefits. You're probably familiar with the Healthy Hunger Free Kids Act of 2010, which is often associated with Michelle Obama and the Let's Move campaign. And this resulted in huge changes to the National School Lunch and School Breakfast programs, which were implemented in 2012. And we'll go over a little bit more in more detail. And it also, the Healthy Hunger Free Kids Act also resulted in some changes to CFP that went into effect in 2018, though these were a little bit less strong. So focusing in on what happened with WIC, WIC is a program where pregnant and postpartum and breastfeeding moms get benefits so that they can use them in a store to buy a certain list of foods. There are benefits to support breastfeeding in particular and counseling services for breastfeeding. There's also formula benefits for babies who need formula or supplementation, as well as from infancy up to age 5, there's sort of a set package of foods that support healthy development. And prior to 2009, this list of what you could use your WIC benefits for included milk, cheese, eggs, juice, peanut butter, dry beans, baby cereal, and baby formula. So it did not include whole grains. It included a pretty large allowance of juice and a pretty large allowance of cheese. And it didn't include fruits and vegetables. After 2009, there was a cash value voucher, so folks could buy a lot more fresh fruits and vegetables with their WIC benefits. You had to buy whole grains instead of refined grains, which we know is a huge driver of nutritional quality and also helps promote healthy weight. And a huge body of literature found really wonderful results of this package change. So from before to after, participants reduced the total calories that they were consuming and buying. Their juice, that sugary juice purchases went down, and huge increases in whole grains and fruit and vegetable consumption. We also saw, as you might expect with these kinds of dietary changes, that over time, prior to 2009, the percentage of 2 to 4-year-olds who participate in WIC, who again are these low income, very at-risk kids who are bearing a disproportionate share of the burden of the obesity epidemic, this was increasing. And then in 2009, after those package changes went into place, it just reversed. It went in the other direction. So it had this wonderful impact for promoting healthy weight for young children and helping to get them starting off on a healthier diet and forming healthier habits for the rest of their lives. When moving up to CFP, as I said, those are part of the Healthy Hunger Free Kids Act. This is sort of a list of some of the changes that were made, but I just wanted to highlight some changes to juice, changes to whole grains, limiting grain-based desserts, which I'll talk a little bit more about later, and then setting some clear standards for how much sugar could be in yogurt and breakfast cereals that are served through these meal programs. And broadly, this is just a research that my team did, but others have done some research as well. We found some pretty good changes in terms of children's intake of food. So you can see here, they've increased their fruit consumption and a little bit of their vegetable consumption, definitely increased their whole grain consumption, which was like basically nothing at the beginning. and reduced their refined grain consumption. So I know we're talking about added sugars today and sugar intake, but refined grains you can kind of think of as being part of that equation as well because of the way that our bodies treat refined grains. So this was a huge change for the program and started to show a lot of promise, although you'll see that not everything is really moving entirely in the direction that you'd hope. Like there's still quite a lot of refined grain consumption. There's not really a significant increase in vegetable consumption, things like that. The Healthy Hunger Free Kids Act changes for the school lunch program really overhaul the program in a dramatic way. And I'm sure most people on this call are familiar with a lot of the news stories about people saying like, oh, the kids are throwing everything out, they hate it, everything's too healthy. And of course, you know, the last several years we've seen attempts to roll back the National School Lunch Program standards to make them less healthy again. But what happened was, you know, we switched everything over again to whole grains, made age-specific recommendations for meal sizes, so you didn't have kindergartners eating the same size meal as like a high school student, and then also really increased that requirement for vegetables. And the other really important thing, particularly when thinking about sugar-sweetened beverages and foods with added sugars, is as part of the Healthy Hunger Free Kids Act, for the first time, there was a requirement that we limit the kinds of foods and beverages that are available through school vending machines and stores. And so the Smart Snacks program applied to sort of all the things that you can buy at school outside of the regular meal program, and really kicked out a lot, most of the sugar-sweetened beverages that could be available in school settings, and promoted water. It kicked out a lot of unhealthy snacks. And what we've seen from the Smart Snacks policy in particular, when we've looked at similar policies in other settings, some colleagues found 22 fewer grams of sugar consumed per day among students from before to after the implementation of a similar policy. The Childhood Obesity Intervention Cost Effectiveness Study estimated that Smart Snacks, if fully implemented, could prevent nearly 350 cases of childhood obesity and save $790 million in healthcare costs. So these are huge policies with really the potential for huge impact, especially with taking out some of the sugary, toxic foods that are in a lot of school cafeterias. So huge success story. And again, when researchers have looked at this, for school lunches in particular, they found, you know, the average calorie content has gone down. So all of this is, and this is from the USDA's own research that they've done. They found significant drops in calorie content. Other researchers have found increases in fruits, vegetables, and whole grains, reductions in starchy vegetables, and energy-dense foods, and just an overall improvement in diet. And again, recently we saw sort of the same thing that we saw with the WIC package change as well, that for kids who are in poverty, who are the ones who, again, are more likely to be consuming these school meals, and are also the ones who are more likely to bear a disproportionate share of the burden of obesity in this country and poor diet. Their trajectory for obesity prevalence was going up until the Healthy Hunger Free Kids Act was implemented. And after it was implemented, we see that children in poverty's trends in obesity go back down. So the difference between what we would have expected they would have done if the trajectory had kept going versus where they actually ended up, we would estimate that that's about 500,000 children in poverty who do not have obesity now because of the Healthy Hunger Free Kids Act potentially. So really huge impact, huge success story of the program. And again, this is consistent with other research that has shown huge improvements in diet quality for low income and low middle income students as well. COVID, of course, has thrown just like everything, it's thrown a bomb at all of this. So it's really thrown the inequities in our food system into very sharp relief. This is an estimate of how many missed school meals have happened because of COVID or happened in the spring. So this is about, I think this ends up being 1.1 billion missed school meals just by the end of April from last spring because of people not being able to get to school. And school districts are trying so hard to distribute these meals, to get them out to kids, and try to make sure that they're feeding these kids who really need these meals and have been depending on them. But it's still being estimated that only about 15% of the children who actually need them, so 15% of those kids who normally qualify for free or reduced price lunches, are actually getting those meals. So it's really showing just how important some of these programs are, both for preserving diet quality and also preventing food insecurity for these kids. In terms of where we could move the needle more for some of these policies, one simple thing would be just, or it's not that simple, but to increase participation in these programs. So between 50 to 75% of childcare programs we estimate don't participate in CECFP, so it's just left there on the table. And it could be something that could really help improve the quality of what young children are eating when they're in childcare. We know that participation in WIC drops off very dramatically after a child's first birthday. That's in general, that's not just in response to sort of the recent chilling effects of public charge. That's been happening for a long time. And we also know that participation in school lunch is incomplete, especially for full price students who could really probably benefit from it as well. So community eligibility provisions, which allow for sort of everybody to get a free meal if the community has a large enough share of low-income kids, or just universal school meals, which is basically what we're seeing this year with COVID waivers for school food programs nationwide. Those are things that could be considered for trying to actually make it easier for folks to participate in National School Lunch and for more people to get those benefits, again, post-COVID, when things will hopefully be somewhat back to normal. And then also expanding the reach of WIC and CECFP, which is something that lots of folks are trying to figure out how to study. Another thing where we can move the needle more, thinking about sugar in particular. I mean, a lot of these programs have done an outstanding job of removing sugar-sweetened beverages from kids' learning environments or their care environments. But there's still a lot of added sugar in the food. So there isn't actually an added sugar limit to most of these standards. So for example, this is something that showed up in my son's school lunch package a little while ago. It was the super sliced banana bread that was, a whole grain banana bread slice. So it was like healthy, but it had 16 grams of sugar in it. So which is a big amount. And my son is like 6 years old. That's a lot for like a 6-year-old to be eating in one sitting. CECFP, we have these sugar limits, but you can still kind of get some stuff that has a lot of sugar in it through those rules. So kids can still get pancakes and waffles and French toast and muffins and things like that. That still qualifies. They can still have like pretty sugary yogurt. So tightening up some of those added sugar rules might help. And this you can see on average how much added sugar is in a lot of school meals at the moment. It's quite high. This is just for lunches. So we'd estimate almost 20 grams of added sugar per meal, per lunch per day.
Erica, I'm sorry to interrupt. I just want to be mindful of time. And I think we've got just a couple, maybe 2 more minutes.
Oh no, this is my last one. Sorry. Okay. So yeah, I think that was my last one. Oh no, my last one was just to say, as we're sort of thinking about what to do next, I think it's important to think about how innovations can come from the local level. So for example, those smart snacks rules came out of a lot of work that had been done in school local wellness policies that had been shown to actually have a huge impact on kids' health. So Boston, for example, was a leader in implementing a sugary drink ban long time before the Healthy Hunger Free Kids Act was passed. So I think when we think about ways to sort of improve equity and get equity into some more policies and also really get at that added sugar piece, sort of looking to what the community has done is going to be key.
Wonderful. Thank you so much. That graph from Healthy Hunger Free Kids is probably the best data I've seen in 2020. So thank you. All right, why don't we turn it over to Julie?
Thank you. Good morning, everyone. And there's lots of great questions coming through, so I'm gonna try to really keep to time here, and this is gonna be fast, so please just stay with me. I wanna start by saying just a little bit about the Public Health Law Center. We're a nonprofit legal technical assistance center located at the Mitchell-Hamlin School of Law in St. Paul, Minnesota. And I wanna start by acknowledging that the land where we are located is near Bodote, where the Mississippi and Minnesota rivers meet, and which is the birthplace of and center for all things for the Dakota people who have lived here since time immemorial. This region is also home to many Anishinaabe and other indigenous people from many tribal nations, and that indigenous people have made and continue to make countless and uncounted contributions to our communities and our region. Now, at the Public Health Law Center, we believe that everyone deserves to be healthy. We are attorneys, policy analysts, communication specialists, and administrators who work to support public health officials, advocates, researchers, and community groups in developing public health laws and policies that are grounded in community, science, and good law. We focus on public health policies to prevent and reduce chronic diseases and promote health equity. And we concentrate on the 3 issue areas you see here on your screen: reducing harmful use of commercial tobacco, helping with policies to support culturally appropriate opportunities to be physically active and to have access to affordable, healthy, and culturally relevant foods. Now, at the Public Health Law Center, we believe that racism is a public health crisis that demands sweeping policy and systems change. This means that we need to push ourselves and work with our partners to understand how structural racism impacts our work, and that, of course, applies to sugary drink work. Now, there was a question about some definitions. I put these definitions that we use at the Public Health Law Center about equity and health equity on the screen. I'm not going to read them, but you can see what they say. Closely linked to the concept of health equity is the concept of health disparities, which are differences in health among groups of people that are closely linked with social, economic, and/or environmental disadvantage. That's from Healthy People 2020. And of course, the factors that make up the root causes of health disparities are diverse, complex, evolving, interdependent in nature. We often hear these factors talked about as social determinants of health, and which of course are understood as the conditions and the environments in which people are born, live, learn, work, play, worship, and age that affect a wide range of things: health, functioning, quality of life outcomes, and risks. So what has this got to do with sugary drinks? Well, very quickly, Sarah talked a little bit about the consumption data. We eat too much sugar. We get a lot of it from sugary drinks, and there are significant racial disparities in sugary drink consumption rates. And so that's one point of this. This didn't happen, though, of course, accidentally. There was this is part of structure, and it's a reflection of intentional and systemic processes and systems that are designed to and that result in inequitable health outcomes. And so you have to react with equal intentionality to dismantle these processes. So I'm going to talk just very quickly about some of these structural factors. One part of this is racially targeted marketing. I think you probably are familiar with this. It's known as a marketing strategy that breaks down the market into various segments and plans marketing strategies accordingly to each segment to increase the market share within that segment. Well, the tobacco industry is well known for using target marketing strategies to attract youth, particularly youth of color and LGBTQ+ youth. The beverage industry is following the big tobacco playbook very closely. Here are some examples. Several studies have documented the use of celebrity endorsements by athletes and entertainments of color to promote sugary drinks and to expand the market share amongst Black and brown youth in particular. We also have ample data showing how Black children and Latinx children are targeted with sugary drink advertising, both through media outlets as well as in the environments in the neighborhoods in which they live. So the Rudd Center has a lot of data about that from their junk food marketing reports or fast food marketing reports. Salud America also has data, and you see many, many studies about this. One thing I particularly want to note is that we particularly see lower wealth African American communities having a lot more outdoor advertising and being bombarded with these sugary drink ads. And we have similar data with Latinx kids as well. Now, these racially targeted marketing practices are exacerbated by food apartheid systems that stem from systemically racist practices such as redlining, which have caused Black, Latinx, Indigenous, and people of color to be concentrated in communities with lack of access to healthy, affordable food and easy access to unhealthy food, meaning that there's lots of fast food and convenience stores and few supermarkets compared to white neighborhoods. And we saw some of this reflected in the impact data that Sarah talked about for how taxes can impact purchase and prices. Another consequence of systemic racism is that Black, Indigenous, Latinx, and people of color lack trust in their drinking water and perceive it to be unsafe, and for good reasons, and that this perception is associated with drinking less water, either tap or bottled, and more sugary drinks. So what does this mean for our work? Well, if you've been working in policy for a while, and I think most of you have, you know that a lot of the work is about building relationships and information gathering. And Sarah quickly, she had a slide about implementation issues with sugary drink taxes, and all through that was a lot about relationship building, communication with retailers, giving time, communication with the public to build support. And so we know that this is a super important part, and in the sugary drink context, this is even more crucial. And the food and beverage industry knows the value of this relationship building. They invest time, energy, and money in cultivating relationships with policymakers, and they have been very strategic in building and leveraging relationships with racial and ethnic organizations, unions, and similar types of groups to mobilize opposition to sugary drink measures. I bet many of you will remember the infamous New York City Board of Health rule that restricted soda cup sizes to 16 ounces, and which was struck down by a challenge from the beverage industry back in 2013. Now, there were 8 plaintiffs on that case. The last plaintiff listed on the complaint was the American Beverage Association. Do you know who the first 2 were? They were the New York State statewide coalition of the Hispanic Chambers of Commerce and the New York Korean American Grocers Association. So just think about that. Now, if you've been keeping up with some of the soda tax campaigns and how they've played out, you know that the industry doesn't stop at leveraging real relationships, but will also create consumer front groups to create the appearance of community-based grassroots opposition to sugary drink reduction efforts. We've seen that happen in Washington, California, and even here in Minnesota, just to name a few places. So healthy food advocates have to be just as strategic. From a public health and equity perspective, of course, this does not mean that you create fake front groups, but just the opposite. It means putting the time and the energy and money to forge real, lasting working partnerships with people from across a community, but especially the people who are experiencing the worst health inequities, and so who should be the ones to most benefit from the policy effort. We have seen way too much of how laws and legal systems have been and continue to be used in this country to create and perpetuate inequality and health inequities. Changing these systems requires a holistic, community-driven approach that keeps the social determinants of health and equity impacts squarely in focus. And to do that, it takes advocates who are committed to equity and advocates who have come from the communities who are most impacted. And I think you have to remember, I mean, we all know this, that it's not just about sugar or salt or fat, it's about food, which connects with family, culture, comfort, and survival. So with food policy, that approach of nothing about us without us has deep significance, because as this artwork reflects on the slide, if it doesn't include us, it isn't for us. And that is a waste of time. Now, I know it is hard to do policy work, and it may feel really hard and slow at times to do policy work that is founded in community, because it means a lot of conversations, working through competing priorities, and negotiating trade-offs. But I believe, and I have seen, that the payoff for this is exponential, because when you get what you get when you bake equity into the process is better, stronger policy, one that can withstand industry dirty tricks, that will have both deep and broad support, and that will weather time and political winds, and will help to build community power, which will mean a healthier, more vibrant community for everyone. Now, there are many resources to support this kind of equity baking in work. Here's one that we created a couple of years ago, which walks the reader through ideas of how to begin to operationalize equity principles in each component of policy development. I also wanted to call out the Praxis Project. They are a tremendous resource. They're a national nonprofit organization that works in partnership with national, regional, state, and local partners to achieve health equity and justice for all communities. They support policy advocacy and local organizing. They provide great trainings and have some really great resources and webinars on their websites about how to work with communities on health policy and build community power. Now I'm getting into the policy options. I'm going to try to cover these in just like a couple minutes. So one approach with food policy work is to start with organizational policies. This is seen as a kind of ground softening, a way to start just kind of changing the conversation, changing social norms. And often this work targets anchor institutions like university campuses or hospitals. And I'm seeing a lot of work now because actually with COVID around food pantries, because the folks who operate the charitable food system know that many of their clients are struggling and are vulnerable to these diet-related chronic diseases. And so they see the value of, I mean, well, of course, they want to meet that needs for hunger, but they also see the value of giving people healthy food. So I've got a couple of resources here. One is a toolkit we worked with, just recently updated with the American Cancer Society to support work with hospital systems, and this other is a healthy eating research document to support nutritional goals for the charitable food system. So moving from those organizational policy approaches, there's also the law approaches, right? And so I've got three options up here. First is this idea of using like food service guidelines or helping to get more healthier foods and limiting unhealthy food, sugary drinks on food that's served or sold in public spaces or through government programs like juvenile justice facilities, park concession stands, government property. The second policy relates to school food policies. Erica talked a little bit about that, but there's things that states and school districts can do to go beyond those federal standards to limit or actually remove all sugary drinks from school facilities or campuses at all times a day. The third is utilizing the child and adult care food programs. Erica mentioned that it's underutilized. One thing that states and some localities can do is broaden access to it, make it easier for providers to participate, but also to incorporate it into child licensing regulations so that it becomes a matter of practice for child care providers to use. Now, related to this focus on kids, we're also seeing laws both at the state and local level to require restaurants to offer as the default healthy beverages and or healthier sides for kids' meals in particular. We've seen over a dozen cities pass these kinds of laws, and more recently, they've been expanding to include not just beverages, but sides. PG County just passed one less than 2 weeks ago. And we also have at least 3 states with these kinds of laws, and there's a couple campaigns going on. I know one in Maryland and one is in Minnesota, and I'm sure there's in other places too. So Sarah talked a lot about sugary drink taxes, so I don't want to talk about that. But as a companion piece to that, Philadelphia has a tax incentive law where they give a tax credit of up to $2,000 per year to merchants who purchase healthy beverages to sell in their stores. Then the policy options on this slide are really new. They're being tested in court currently, some of them, and or very experimental, so they are not to be undertaken lightly. You need technical assistance if you're looking into one of these options. But healthy checkout lanes has been an idea that's been being kicked around for a while. Berkeley just passed the first one in September. It won't go into effect until March of next year, so we'll have to wait and see what happens, but it prohibits junk food or food with more than 5 grams of added sugar or 250 milligrams of sodium in the checkout aisle in grocery stores. And I would say that since usually challenges are filed right before the implementation date, so we'll have to wait and see what happens there. There's also this idea of using warning labels. There's 3 main approaches: putting warnings on menus or menu boards. We've seen Philadelphia and New York do that with sodium, not with sugar, but with sodium. Warning on sugary drink containers. No one in the United States has done that yet. There have been bills that have been presented, but nothing has passed. And then warning and advertisements. It's been tried in San Francisco. Their first version got struck down on First Amendment grounds. They rewrote it to try to address the concerns in the Ninth Circuit opinion, but it's being challenged again. So again, we'll have to see what happens there. And then this last one is using zoning or licensing laws to try to restrict the availability of sugary drinks near schools. That's never been tried to my knowledge, but it's a strategy that's been used successfully with tobacco and flavor products. So there's lots of groups that you can reach out to or that have resources to support thinking about how to approach these policies from an equitable perspective. They're on this slide. There's also many, many local and regional groups. You should be looking for coalitions and groups, partners who are already engaged in racial equity work to partner with on this work. Voices for Racial Justice here in Minnesota is one example. The Kansas Health Foundation is doing a lot with communities in Kansas. Those are just two examples. Finally, I just wanted to mention that there are some funding opportunities to support this work in case you have a policy idea that, again, is grounded in community, but you just need some help with it. CSBI has a funding opportunity right now, open until the end of December for certain kinds of policy work. And American Heart Association Voices for Healthy Kids occasionally also routinely, periodically has opportunities. So I encourage you to check that out. So thank you very much. I'm sorry that I had to go through that so quickly and that we don't have more time for questions, but I think we have a couple minutes at least.
Yes, thank you so much, Julie. That was amazing, given the time constraints. So let's dive right into some audience questions. We only have about 5 minutes. Let's start with, there's an enormous amount of interest in the Q&A on beverage taxes, and then this link between equity, right? So there are different perspectives on this, and I worry that these aren't very equitable. And so Sarah, maybe we could ask you to comment, what's your take on that? And are there ways to make these more equitable?
Yeah, so I'll be brief and then maybe kick it over to Julie if she has thoughts. I think that it really depends on the perspective that you're taking. If you're looking at this issue as a hardcore economist, you're going to say that beverage taxes are regressive. You're going to say that you're asking the poor to pay more money. If you take a step back and wrap your arms around the evidence, what you should reasonably conclude is that what the studies suggest is that beverage taxes may have a larger impact, a larger positive impact on higher risk groups by decreasing consumption among those groups, and then reducing public health harms as a result, and also by funneling the revenue generated back into programs that can help the community.
Great, thanks. Julie, anything to add?
Yeah, I would also add that diet-related chronic diseases are regressive. And also that the idea of the funneling of funds back into the communities, that's super important. And that's also not accidental. That has to be part of the deliberate design of the taxes. And that there was a question about community support. There's lots of experience to show that when you do that, there is community support for taxes when people know the money is going back to address the health problem. And that's where also groups of color are calling for these taxes, because if that money is going back to help their communities, they support that because they see the problems of diabetes and heart disease, and they know that this is a crisis that needs to be addressed.
Great, thanks. Erica, one question that came up is we're seeing changes because of COVID to different school meal programs and distribution of food. And from your perspective, should any of these changes persist? Are there lessons learned here about how to carry this forward once the pandemic's over?
And that's a great question and a great point. There have been some silver linings, I guess, from COVID, and I think that that's one of them. But right now, for all intents and purposes, we have universal school meals in this country right now. Like everybody is getting free meals pretty much nationwide. And so we're actually able to see sort of what the impact of that can be, especially when we think about kids who might be not quite able to qualify for a free or reduced price lunch, like their family income like just puts them over the edge, and now they're able to actually have these meals at the same rates as their lower income peers, and higher middle income kids too that can have these meals and are maybe getting exposed to some of these meals for the first time. So I think that that's definitely something that I know a lot of people are studying it this year, and I think it's going to be really encouraging to see sort of what happens, because when we've looked at some districts that have done more universal meal expansions or community eligibility provisions, we've seen some really strong impacts on diet and academic achievement. So I think that that may be a silver lining from this year to see sort of what happens when we do this.
Great. And one last question, 20 seconds. Sarah, are these beverage taxes hurting small store owners who are often BIPOC individuals? What do we know about that?
We have limited evidence. What we find in Philadelphia is that they do not appear to be hurting store owners, but it's an open question, and it's an area where we need to have more research.
Great. So we're just at time. Thank you so much to all the presenters who really did a beautiful job packing in so much information. And thanks to Emily and your team and everyone who joined in the terrific questions.
Thank you.
Thank you.